Hi guys, welcome back once again to my channel. If this is your very first time I'm coming across my channel, you're welcome. If you are a returning subscriber, thank you for coming back. If you're a new subscriber, thank you for being here. You might want to consider subscribing to my channel so that you won't be left out when I upload new content. Now, in today's video, I am going to be talking or answering some questions that has to do with nursing. You know, most people feel that nursing is kind of like a difficult course. Since it's a medical course, people tend to misunderstand it a lot. So that is why I'm here today to answer most questions that I've received. I'm going to try as much as possible to answer them to the best of my ability. So let's just get right to this video. I already wrote them down because I was actually studying, and I felt like pause, make this video and continue with what you are doing. The first question I have here is, can a non-scientist student do nursing? So the question is yes. If you do not have a nursing background, like if you do not have a science background, if you're not science inclined, you can actually consider doing nursing. I myself, in my secondary school, I didn't do anything that has to do with science. I wasn't a science student. I've never ever liked science because of physics and chemistry, and then further maths also. I've never liked science at all. I was in commercial class. I was hoping to be an accountant, but along the line things change, priorities change. You know, you start putting your eyes where money can actually come out from, excuse me. So somebody that is not science inclined can actually do nursing so far as you are open and willing to learn. Because if you do not have the zeal to want to learn, if you do not love what you want to do, then there is no way you can actually do that. So coming into nursing, you're going to be taught everything. You're going to be taught the physics, you're going to be taught the chemistry, you're going to be taught every other aspect of science. So if you are sharp and if you're intelligent, if you're smart, which I believe everybody is, you're actually going to do well, because you're actually going to start learning those things you did not like before. How many courses do nurses study? The courses differs. I don't know about other schools, like I don't know how other schools operate, but in my school, the first year you have to undergo 8 courses. The second year, like the first year of the first semester, you have to undergo 8 courses. The second year of the first semester, you have to undergo 7 courses, so you're dropping 1 course. So the first year of the second semester too, you have to undergo 10 courses. That's the first year of the second semester. The semester is 6 months. So the first year of the second semester, you have to undergo 10 courses. The second year of the second semester, you have to undergo 13 courses. The first year of the third semester, you have to undergo 10 courses. The second year of the third semester, you have to undergo 7 courses. So your courses differs according to the class you are in, or according to the year you are in. So for my school, it doesn't have a fixed, like you have to undergo 8 courses throughout till the end of your nursing career. No, it changes as you progress in your nursing career. So the other one is, do nurses do operation? No, nurses do not do operation. We are not surgeons. We do not run operations. We do not even assist in the operation room. Like, we do not even enter the theater room. So that one is strictly the business of the doctor and the surgeons and all those sets of people. But nurses do not get themselves involved in that aspect. It is not in our field to do that anyways. So another question is, are doctors greater than nurses? That question is actually a vital question. Many doctors feel to want to be, doctors, people. If I say people, not even people, civilized people, like I mean worldly, like patients, anybody that in the world, they all believe that doctors are greater than nurses. So even when they come to the hospital, even when they go to the hospital and then they want somebody to attend to them, even when they see the nurse, they still ask the nurse where the doctor is. So doctors are actually not greater than nurses. We have the same responsibility, which is to take care of humanity, to make sure they are fine, to provide help and give them assistance as far as we can. But it is just that we have similar objective, but it's kind of different. There is also a slight difference between us and them. There are things that they can do that we can't do. So the next question is, studying nursing in a uni versus studying nursing in a college of nursing, which one is better? Over time, university students and college of nursing students are always having a clash. But personally, I feel like college nurses, like school of nursing students, actually have more advantage compared to a university student studying nursing. Reason is just that college of nursing students actually experience more practicals than those in uni. I know the university students are going to be like, oh, but we have 1 whole year to do internship and all that. Yes, but it's actually not enough. The next question is, what is the most difficult course in nursing? I don't think there is any difficult course in nursing. I think for you to dictate that there is a difficult course, it has to be from your own point of view. It has to depend on the course you hate and the course you like. If you are having problems in chemistry, no. If you're having problems in anatomy and physiology, then that is actually going to be your most difficult course, just because you don't like the course or because you don't really understand the course very well. If you're having problem with foundation of nursing, then that is going to be your most difficult course. So for you not to have any problem with any of these courses, or for you to actually have a best subject, you have to like all the courses you're studying as a nurse. Not even as a nurse, in general, you need to like what you're doing, then you're going to actually enjoy it. But say this one is difficult, this one is not difficult, I don't know, because I have not experienced that. So that is just it. So the next one is, why are nurses always harsh? Well, I won't say that nurses are harsh, because in a nursing profession, in the nursing and midwifery council as a whole, like in a nursing profession as a whole, there is a code that is guiding them. There is a code of ethics that is guiding them. And in this code of ethics, they are taught, nurses and midwives are taught to always be patient, be lovely, be compatible, sociable, everything and everything. So if you see a nurse that is harsh, then it is as a result of the personality of the nurse. But professionally, every nurse is trained to be humble, because you must like the person that you're talking to. If a patient comes to you with a problem, if you are harsh to the patient, then the patient is not actually going to open up to tell you what he or she is really feeling or the changes he or she is actually experiencing. But if you are all lovely, oh, good morning sister, you're so beautiful, what is happening to you, why is your face like this? When you talk, the manner in which you are talking to the patient is actually going to make the patient be like, I woke up and my tummy, this place is paining me, this is paining me, and then you know what to do. But if you're like, madam, why are you sitting there? Close this your leg now. Why didn't you brush your teeth? If you are harsh to the patient is actually going to be restrictive. She's not going to be free. So it is actually you that is going to suffer it, because the patient will not tell you anything that he or she is feeling, and then you will actually have to run majority of the tests to actually dictate what is happening to this patient. So nurses are not harsh by profession. It is a team of the mind, is a personality thing that makes them harsh on maybe their family problems, their marital problems, any problem that they're having. It is actually the one that is making them harsh. Next question is, can a nurse become a doctor? No, a nurse cannot become a doctor. Like, you can't study as a registered nurse, you can't study further to become a doctor. The only thing you can study further to become a midwife. You have a BSc in midwifery and stuff. But say study to become a doctor, it is not possible. For you to become a doctor, or if you want to become a doctor as an already registered nurse, you have to go back to your medical school. You have to go back to scratch and start your school from year one, your medical school from year one. Then you actually graduate graduate and become a doctor, but originally you cannot become a doctor as a nurse. Next one is, do nurses prescribe drugs? Yes, of course, nurses prescribe drugs. We also study a course known as pharmacology. In pharmacology, we are taught drugs. We are taught what each drug does for different ailments and whatever. So nurses to have an idea, have the idea of drugs and what it does to individuals. So nurses can prescribe drugs. It is just that we give the doctors the respect most times depending on the ailment of the person. We let the lab pharmacies run their tests, bring the reports back to the doctor, and then we let the doctor prescribe the drugs. But if the doctor is off duty or the doctor asks us to prescribe the drugs, we are going to prescribe it. We're just looking at the doctor like our manager, but deep down we are all the same in the hand of the creator. So the next question here is, what should I know before going into nursing? Well, before going into nursing, it is very important that you love your profession already. You don't really have to know everything, my dear. You don't really have to know heaven and earth. You don't really have to know anything. Just prepare your mind to be willing to learn. Once you are willing to learn, when you go into the field or when you go into your school, anything that you are going to be taught, you are going to understand it and love it. But if you're not willing to learn, that's where the problem comes in. But to answer this question, what do you need to know before going into nursing? Just know that you have to be lovely, you have to be meek, you have to love people, you have to learn how to talk to people, because it is a social affair. You're going to see many people coming in and out of the hospital, so you should know and learn. You should be a social person. You shouldn't be an inferior. You shouldn't be an introvert. You should be an extrovert. As a nurse, you don't sit down and allow your patient come to greet you first. No, you reach out to your patient. Good morning, ma. Good morning, sir. Oh my God, you're looking beautiful. Chief. You held them. Good morning. Hope you have eaten today. Hope you're taking your drugs. Are you fine? Are you experiencing any pain? You should be a social person. So just put it at the back of your mind that for you to be a nurse, you should be a social person. You should know how to talk to people and make them crack some jokes, make them laugh, so that they actually forget about their problems and see life from another angle and perspective. The next question I have here is, on a scale of 1 to 10, how well do you like nursing? On a scale of 1 to 10, I think for now I like nursing. I'll rate it 8% over 10, just because I have not started practicing the nursing profession as per se. For now, because I'm still doing the theory parts, I like it. But when I start going into the world, seeing things, seeing this and that, I don't know if it's going to change, but I know I like nursing, so I know I'm going to like it more. But for now, 8 over 10 is what I'm giving myself. So the last question I have here on my list is it bad for nurses to keep their face in a type of way when rendering certain helps? Well, certain helps like collecting feces from a patient, collecting vomitus, like the vomits of a patient, collecting it from the patient, collecting the urine from a patient. Is it bad for you to keep your face in a certain kind of way? I don't think it's bad actually. It's bad when you let the patient see you, because it is actually going to make the patient feel a kind of way too. The patient is actually going to be feeling bad. But you should also know that for some people, even when we look at our own feces, we are like, ew. When we vomit, we cannot even look at our own vomit because we are irritated by our own self. Now I'll talk more of our patient's own. So it is not bad for you to keep your face in a certain kind of way. It's just that when you are collecting all those things, or when you are examining all those things, you actually cover your face with a face mask so that nobody sees your facial expression. Cover your face with face masks, protect your eyes so that nobody sees your expression, especially the patient, because the patient is actually going to be feeling bad and stuff like that. But it's not bad, it's normal for you to be like, oh my God, but that's just it. So guys, that's basically all I have for you today. If you did enjoy watching this video, don't forget to give this video a thumbs up, subscribe to my YouTube channel, and share this video. And I'm going to see you guys in another of my video. See you guys next time, and bye bye.